youngsters who go without a helmet in the road, I tell them, nobody can help you if your head is broken. Doctors cannot do anything for brain injury. We just hoping against hope that something will happen. If the patient recovers, we take the credit. If the patient dies, we give the credit to God. He always kills and we save. So have a helmet because nobody can save. Now these kind of things modern medicine can do. We can't throw modern medicine out of the window because the water in modern medicine is bad. I don't want to throw the baby out. I still want to keep the baby. But modern medicine also requires a lot of refinement. I'll give you an example. In Vietnam War, America had a 5-star hospital 10 minutes from the war theater. So a grievously injured soldier is lifted in a C-130, which in itself is an ICU. The C-130 which lifts these people is an ICU. So starts blood transfusion, etc. immediately. So he's taken to the ICU, 5-star treatment. Poor British had a war in Falklands. No enemies, no friends in South America. And then the whole patient had to be shifted 16 hours to London. And some of the patients there were left on the snow, grievously injured patients, for as long as 24 to 48 hours. Because the war occurred October, November, December. Now, audit now shows that per capita death of comparable grievously injured soldiers was slightly more in Vietnam than in Falklands. People are working now. Scientific brains are working as to why it happened. One of the reasons is, you immediately interfere. Nature has provided a beautiful system inside in injury. You and I were in forest. We were hunter-gatherers. Tigers comes and tiger eats. Tiger can't eat whole of you. It doesn't have the appetite. It will eat maybe your hand. Did I say anything wrong? Can you see an electron? Huh? You can? Have you seen, sir?
All the diffractions are you are living with electrons all the time.
That's a different thing. That's a different thing. My question, no, wait. Answer my question. Have you seen an electron?
This is not a relevant question.
Acha, okay. The question itself is irrelevant. But nobody can see an electron. How do I see you, sir? Physics wise, how do I see you?
You are seeing me through electrons. Basically, the electrons are activating your retina.
Okay, alright. A few photons leave your body and strike my retina and I see you. If one photon leaves an electron, the electron is not an electron. So you can never see.
So perhaps I would not like to argue. I'm a physicist.
Good, you're a physicist. I like it.
I would like to argue.
Thank you. Leave it at that. Anyway, my interpretation is very simple. You can't see an electron, you can't see God. But anyway, let's not go into God. Nature gave us an autonomic nervous system. Most of our health problems are because of the autonomic nervous system today. In the forest, you saw the tiger, and when you saw the tiger, you are frightened, you want to run away. To run away, you require glucose. So there is no glucose aid in the forest. So nature said, okay, I will give you gunny bags of sugar in the liver called glycogen, from where you get your glucose. And for that, its sympathetic system produces adrenaline. Adrenaline goes to the liver, sugar is released. It's called neoglucogenesis. A biochemistry professor will tell you. Neo means new, gluco means glucose, genesis is birth. Now the sugar goes up, you can run. Your blood pressure has to go up, so adrenaline increases the blood pressure, vasoconstriction. Your heart rate has to grow up, chronotrophicity, heart rate grows up, and you run. When you run from the tiger, if you survive the tiger, your whole thing comes down. You're up. The sugar which has gone up has come down. The sugar, blood pressure comes down. Today we have transformed ourselves into society. Here there are no tigers, but there are human tigers here. Your husband may be a tiger, your wife may be a tiger, your boss may be a tiger, your assistant may be a tiger, your peon may be a tiger, your driver may be a tiger. When you look at these people, your blood pressure goes up, your sugar goes up, but you can't run away from them. You got to stay there. And when you stay there, they remain high, and over a period of years, you become a hypertensive, you become a diabetic, you become, all these things. All these things can be managed by change of mode of living.